Hey YouTube! So I'm making another video as on Friday I went to the hospital for my pre-assessment. I had an appointment at 8 o'clock in the morning with my orthodontic surgeon, and then at 1 o'clock I had an appointment with the anaesthetist and a couple of the nurses, and that's when they took my blood. So I went in and I was seen by one of the student doctors, and he explained what they were going to do in my surgery, and they said that there's 4 things that they can do. The first one is they take the wisdom teeth out. The second is they break the bottom jaw. The third is they break top jaw, and the fourth is they actually rearrange your chin, as when they correct your jaw sometimes your chin can be in the wrong place. But at the moment they don't know what they're doing with me and whether I'll have all 4 or just wisdom teeth, lower and bottom. So yeah, he explained that to me, and then they took a lot of x-rays so they can, I don't know, see stuff that they need to see. And then they took some pictures, profile pictures, and she got me to look in different directions and relax my jaw so that it's in its natural position. Then they took some impressions, and this was horrible because it made you gag really bad, and the stuff tasted revolting. It was horrid. But yeah, so they took 2 impressions of the top, because they do like a practice surgery on the impression, so they have to cut up the top jaw and then rearrange it, so that's why they had to take 2 impressions of the top. And then she took 1 impression of the bottom, and then some other random doctor came and looked at me and classed me as a class 3 underbite, which is basically the worst you can get, which is great. And then this was at 10 o'clock, so we had 3 hours to wait until we went and saw the anaesthetist, and that's when they took my blood. And I have a huge phobia of needles, so I freaked out big time and wouldn't sit in the chair. So then if anybody else has this problem, phobia of needles, if you express your worries to the anaesthetist, then they will make arrangements for you to be put out under gas, and then they'll put the IV in so that you don't cause yourself unnecessary anxiety, which is what I would do. So then they showed me around the ward, and it was really good. My surgery's in the Queen Elizabeth II Hospital in Halifax, Nova Scotia, just in case anybody lives around me. It's really good. It's on the 10th floor, so I get a nice view, and I'm in a ward, so after my surgery I'll be in a room with other people who've had the same procedure done, which I think will be really interesting. And I'll be in the hospital for 2 to 3 days, and they send me home when I'm able to eat or drink and take my medication. And they gave me, I don't have them with me, but they gave me these pamphlets of information, and one of them's corrective jaw surgery, and the other one's just same day admission surgery or something, which just explains what I have to do when I go in. So I thought I would tell you all this just because nobody that I've seen on YouTube has described a pre-assessment, so I didn't know that it was going to be happening, but now I do. So yeah, that's what I did. What else is there? So I have another appointment tomorrow because my actual surgeon wasn't there on Friday. He was on vacation. So I'm going in at 8:30 tomorrow to meet him, Dr. Gooday, and I'm hoping he might be able to tell me what they're doing to me, breaking my top and bottom and rearranging my chin. So I've actually never heard of anybody having their chin rearranged, but yeah, apparently that's a possibility that they might do. I think that's it. If anybody has any questions, just feel free to post them under this video, and I will try and respond. Okay, bye!